Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority. Greetings and welcome to our latest Let's Talk Mental Health webinar. I'm Tom Castañeda, the System Director of Marketing and Public Relations for South Texas Health System. Thank you for joining us. Mental health is vital for overall well-being and quality of life, so it's important to prioritize mental health, seek help when needed, and cultivate healthy habits that support mental well-being. So to help Rio Grande Valley residents prioritize their mental health, STHS Behavioral hosts these monthly Let's Talk Mental Health webinars. By providing education on common mental health challenges and offering strategies to maintain good mental health, we hope to break the stigma surrounding mental health and encourage people to be more open about their own struggles and get professional help if necessary. Now, in this installment, we'll be discussing suicide prevention. Every 11 minutes, someone in the U.S. dies by suicide per the CDC, making it a leading cause of death nationally. But that's not all. Nearly 13 million adults seriously thought about suicide, nearly 4 million made a plan, and 1.5 million attempted suicide in 2023 alone per the CDC, making suicide a serious public health problem that can have lasting harmful effects on individuals, families, and communities. Suicide does not discriminate, and there are many factors that contribute to it. The goal of suicide prevention is to reduce factors that increase risk and increase factors that promote resilience. So to help educate the Rio Grande Valley on important strategies for suicide prevention, we're joined by Linda Cantu, a licensed professional counselor who serves as the Intake Department Director at STHS Behavioral. Linda, thank you so much for joining us.
Thank you for having me.
Now, when it comes to suicide in the Rio Grande Valley, you work in the intake department. So your department is getting every phone call that comes through with someone who is asking for an assessment or asking for help. How common is it to hear about suicidal ideation on those calls?
It's very common. A lot of times people, when they make that call and they're seeking help, they've already gotten to the point where they don't know what else to do. Or it's family members that are observing these behaviors in them, and they get into a situation where now at this point they're just trying to find a resource that's going to help them. So on a daily basis, we deal with people who are maybe having symptoms of depression and those types of things, but a lot of what we deal with on a daily basis has to do with those individuals who have already chosen to try to do that, try to take their life.
Now, suicide does not discriminate. People of all ages, sexes, everyone, socioeconomic backgrounds, it does not matter when it comes to suicide. But when it comes to a percentage of them who have comorbidities, another mental health condition maybe, it's a large number, is that right?
Well, most often, probably more so in the older population, you're going to see medical issues that sometimes complicate the behavioral health issues as well. It is not so common, but you know, you could have a diagnosis of a mental health condition that is coupled with maybe something having to do with schizophrenia or, you know, hallucinating and those types of things. So having like even with chemical dependency, having a dual diagnosis. So there are individuals who do have more than one diagnosis, and of course that complicates their recovery all the more.
Now, when that person gives you the call and they are, it's basically they're reaching out for help, what steps are you taking to make sure that they're protected? Well,
the first thing that we do when somebody is seeking help is make sure that they're safe. And if they're not the person calling, whoever's calling us, we want to make sure, first of all, to establish that they're safe and to identify what type of risk we're dealing with. So at that point, it's very important to get that information from the beginning, and then we go through a series of questions where we need to know, have they been in treatment before? Are they currently in treatment? Do they take medication? Because if those factors are in place, then that situation becomes a little more serious, more severe, as opposed to someone who maybe this is the first time that they're inquiring. They haven't had any issues with mental health. That will kind of help you gauge the severity of the situation and what intervention is needed at that time, whether it's emergent or where it's someone that you can merely invite to come in for an assessment.
Mm-hmm. And with suicide prevention, it is a community-wide effort. We all play a significant role in preventing suicide, right?
Yes, we play a significant role as friends, as family, as professionals. No matter what profession you're in, on a day-to-day basis, people you work with are like family, and you get to know each other. So in those instances, you can tell when someone's not having a good day, or if it becomes more commonplace for them. And so we all have a role, no matter what our situation is in our life, where we work, or what we do for a living. Teachers, people in those types of professions have a huge impact on interventions that can help kids, for example, and so it's anyone. No one is immune to the possibility of helping save a life.
Mm-hmm. And it all depends on the education you have. You have to know the warning signs, risk factors, and education is key, and you have a great presentation that is going to help us all better understand how we can help in preventing suicide. Right?
Yes. We'll begin by stressing the importance of knowing the impact of suicide, and we're going to begin by highlighting why all this information matters. And the reason it's so important is because it's someone's life that's on the line. Something to kind of put things into context. Every 40 seconds, someone in the world dies by suicide. And we're going to give a demonstration of what that time frame feels like. In that time frame, for some may have seemed like a long period of time, for others maybe a short period of time, families, friends have been impacted somewhere in the world as we speak right now. And suicide affects the individuals that are surrounding the person that carries on this act. Up in the numbers, it says, information states that when someone dies, at least a minimum of 100 and some people are affected by that one person suicide act. In the time that we spend together today, if we can only imagine every 40 seconds in the world, someone is dying by suicide, and loss is occurring constantly around us. But there is hope, and suicide is preventable, and each of us can help save lives. I'll start with this quote. Every suicide creates a vacuum. Those left behind fill it with stories that aspire to rationalize their ultimately unfathomable plight. People may blame themselves or others, cling to small crumbs of comfort, or engage in pitiless self-laceration. Many do all this and more. The effects of suicide here are likened to a vacuum, a void that's created. Survivors either feel the void or fill this void by trying to reason, why would this person that I love so much choose to leave this world? The constant asking of why? Why? Were there warning signs? What did I miss? Or perhaps they fill this emptiness with guilt and find numerous ways to blame themselves or to blame others, or they cling to the slightest sense of positivity, good memories, knowing they made the best of their time with this person, or the danger zone, constant self-injury, figuratively and literally. Today we're going to overview trends, population, methods, propensities, warning signs, strategies, and prevention and resources. And there's 720,000 deaths from suicide each year worldwide. and the United States is at an all-time high of 49,000. In 2023, it was a similar total, holding at a very high level as well. And suicide remains a leading cause of death, especially for youth and middle-aged adults. 73% of global suicides occur in low and middle income families. In Texas, suicide rates have risen modestly in the last 5 years, with highest risk among older adults, white Texans, and rural residents. Access to mental health care remains a major challenge. Imagine 200 plus counties don't have not one psychiatrist. Community-led initiatives such as 988 as a suicide hotline have surfaced to help in trying to reach out to individuals and let them know that they're not alone. And this does show promise. These initiatives do show promise in saving lives. And suicide prevention is possible through these combined efforts: treatment, support, and awareness. In South Texas, here where we are, overall in the US and in Texas, 14 per 100,000 people commit suicide. And when we bring that to our local level and we go by county, that would translate in Hidalgo County, 64 individuals, in Cameron County, 30, in Starr County, 5, and in Willacy County, 1. Of course, these numbers are just one too many. As far as youth, the indicators are that whatever the statistics are in Texas is reflective of the Rio Grande Valley. 19% seriously consider suicide, 15% have a plan, and 10% do attempt suicide. And 80% of males commit suicide. As far as gender, males, there are 39,255 deaths. And in females, there's 10,194 deaths. And if you compare the two, we see that there is a 4-time higher rate amongst males than females, both increasing in 2021. And this is despite all the resources and the efforts to decrease stigma. When we look at age, the highest rates are among those that are older, in the older population, for obvious reasons. When individuals are aging, they are experiencing life transitions. They are also experiencing medical issues that may be causing them limitations in their lives and the quality of life that they live. In youth, there has been a trend of declines in the age category of 10 to 14 and 15 to 24 from 2021 to 2022 after prior increases. 1 in 6 U.S. high school students seriously consider suicide in the past year. And suicide is the second leading cause of death for ages 10 to 34. When we look at ethnicity, the American Indian Alaska Native population has 6.1% a rate of suicide. Asians have 5.7%. Hispanic and Latinos have 4.3%. Blacks have 3.6%, and whites have 2.1%. When we look at socioeconomics, counties with the most insurance coverage have a 26% lower suicide rate versus those that are least covered. So we see a direct correlation here between those that have access to health care based on insurance as opposed to those who do not have the funds to seek out help. We see that the access to this health care can help in mitigating this risk. Counties with the most internet access have 44% lower rates versus those that have least access. And if you think of that, basically it's access to services. The internet has allowed for people to be able to reach out for help. If you look at underserved counties, underserved areas throughout the country, the internet has allowed for people to get educated and an environment, seek help in an environment that maybe is not so embarrassing. They may be more willing to talk to someone over a platform such as a therapist or a psychiatrist. And rates of suicide are higher in rural areas than urban areas for also reasons such as demographic or geographic location and their ability to seek out this help. And the risk is tied to local economics and social conditions in where they live. As far as the methods of suicide, the availability of means to commit suicide strongly influences which method is most common. Firearms are involved in 55% of suicides. The second leading attempt is suffocation and hanging, and the third is poisoning. Excuse me. As far as the propensities in different populations, there's a more prevalence amongst American Indian and Alaska Natives, veterans, rural residents, sexual and gender minorities, middle-aged adults, men, and other contextual factors include economic stress, access to care, social isolation, and means to access. As far as diagnosis, why does it matter to consider what the prevalence is of different types of mental health diagnoses? They're very directly linked to suicide. We see here that a large percentage of people who attempt suicide have mood disorders, and we also see 90% of individuals who die by suicide have a diagnosable psychiatric disorder. Mood disorders, 50 to 60% of suicides are linked to depression or bipolar disorder. Substance abuse disorders is 20 to 40% of suicides, and it's often correlated with depression. Schizophrenia, a lifetime risk, 5 to 10%, but this is usually highest early in the illness. Personality disorders, there's a strong link with repeated attempts, particularly in those who have borderline personality disorder. And comorbidity multiplies risk when multiple diagnoses are present, as you had mentioned earlier. If you have more than one diagnosis, that is going to augment your risk for a crisis. So all of us can save a life. And the way to do this is to be aware, to be educated about the warning signs. So it's not a secret. When someone is contemplating suicide, if you really pay attention, and unfortunately many times when people have successfully completed suicide, those who are left behind, family and friends, they start to have conversations, and at first they are in shock, they had no idea, but once people really start to look at their loved one, they do see that there were a possibility of some missed signs. So your role can save a life, and some of these warning signs that you need to look out for include talking about wanting to die or feeling hopeless. This is particularly noteworthy when you have someone that perhaps is known to be a very outgoing person, be in a good mood most of the time, and now they're having these negative comments and talking about this hopeless feeling. These individuals tend to increase their interactions with others. They withdraw, they isolate, they are known to be someone who is the life of the party or the first one to gather with friends and family, and there's a shift in this behavior. Or some individuals very clearly start to say goodbye. They may say, you know, I hope everything goes well for you for an event in the future, which could lead one to be perplexed, like, well, that's far into the future, and that those types of comments may not make sense. So anytime something doesn't make sense as to the norm of what a person is like, those are things that we need to look out for. More obvious are dramatic mood swings or even sudden calmness. You can have someone who's very depressed, very anxious, or having a lot of anger issues, and they're struggling, and you know that they're struggling, and all of a sudden they seem more positive, they seem calmer, they're not talking about how bad they feel anymore. That is a red flag. That is sometimes the point in their life where nothing seems to matter anymore and they've made this decision to proceed with their plan. If anyone around you is using alcohol or drugs more frequently, that is also a sign. Risky or self-destructive behavior, we're talking about, for example, anyone who is driving at high speeds, maybe being out at all hours of the night without any regard to danger, and maybe having relationships that are not very healthy, and those types of things. Giving away prized possessions is a very obvious act. Once someone, you know that they have something that's very important to them and they want someone else to have it, and that other person knows exactly how important it is to them, that's definitely a red flag. Changes in sleep, appetite, or daily functioning, usually that is going to relate to people who are more closely involved with that person, maybe in the same household. So you can save a life. And these are some pointers as to how you can do that. First, you can listen without judgment. Listening without judgment includes refraining from comments such as, "Oh, you'll be fine. You'll get over it. This day will pass. There's bigger problems in the world." For that person, if they're expressing something to you that is bothering them or a problem that they have, it's important to them. Never minimize the severity of what they're telling you. It's their perspective on a situation. And always express care. Be careful with saying, "Oh, I understand," because really we are not that person. Can we really understand what they're going through? We can try, but we haven't lived their life. So we want to express care in ways that show that we really want to help them, that we may not know how, that we may not be able to relate, but that we're there for them. Ask directly about suicide. Are you thinking, are you having bad thoughts? Maybe you don't have to use the word suicide, but just say, you know, how does your future look? Anyone who can speak to things that are going on in the future is somebody who is planning to live to the future, and someone who maybe isn't will not be able to look beyond the short term. Encourage professional help, and that requires that we all be informed. Where would you go to get help? Before anyone is in crisis, whenever we find ourselves in situations where we can learn about diagnosis, about resources, that's an important opportunity for us. So if we're ever in a situation that we could recommend someone that can help. Remove or secure lethal weapons. If you have an idea, an inkling that maybe somebody has these thoughts and you know that they own firearms or they have excessive medication, never take a chance. Trust your instinct. If you're feeling insecure about them having access, then act. It's better to be safe about that. If it's to the point where this individual looks like they're in active crisis, it's very important to stay with them if they're in an immediate risk. Don't leave them alone. Try to get other individuals involved. It's important to always have a safety net. You may be the person that's with the individual, but it may not be a bad idea to reach out to other friends and say, "I'm here with our friend, they're not doing well. If I call you and tell you that we need something, that means that it's an emergency." Just creating that safety net so that people are not lost in a situation that can be very risky. And of course, having knowledge about the suicide hotline, calling the 988 number. It's the U.S. Suicide and Crisis Lifeline, or 911. When you call 911, it doesn't have to be such a severe situation. Some people may feel like, well, it's not that bad of a situation. Why would I need to get law enforcement involved? It's important to do that because law enforcement is well versed in handling mental health issues, and they're a good resource to at least find a path to try to help them. So in regards to friends and family, we want to stay connected as friends and family. We want to encourage help. We want to have a safety plan in place. We want to be alert for these warning signs that we mentioned and act quickly when the risk increases. That requires us to be prepared. We want to foster hope and remind these individuals that they are not alone, and know these resources, these hotlines, these support groups. Intervention strategies. When we look at intervention strategies among the different age groups, when we're talking about children, some people may be shocked to know that children even know what suicide means. But in our line of work, we do see children at very early ages try to hurt themselves or try to end their life for varying reasons. It has a lot to do with their environment. They may be suffering from a mental illness that hasn't been diagnosed. But when we're talking to children, we want to make sure we use simple, age-appropriate language. You may not use the word suicide. You may use terms that they're more familiar with, as far as hurting yourself, or do you wish you weren't here? Do you feel like no one loves you? Those can be some things that you could ask a child, or ask them, how do you feel, you know, who loves you? Maybe they can identify that. And if you're hearing comments like they don't know or nobody cares, that's something to be in tune to, and encourage open-ended questions. Avoid questions maybe that are yes and no answers, just to see what their wavelength is. As far as adolescents, we want to be direct but not judgmental. We want to validate their feelings. It's very common for us when we hear adolescents talk about their struggles to say, oh, I remember when I was young, you know, we went through certain issues. We can't really relate, depending on your age, you really can't relate to the youth of today, because technology has really advanced exposure to things. It's advanced the opportunities for stress, and we may have not been in a era when we had access to this. Some of the stressors that kids are experiencing today are some things that we would have never imagined maybe when we were at their age. And always emphasize help and support, that they are available. When we're talking to adults, we want to acknowledge their stressors openly. We want to offer practical support and avoid minimizing what they're feeling. In older adults, we want to recognize the stages in life that they're experiencing, knowing that this might be a time in their life where they feel lonely, their illnesses are getting the best of them, they're losing friends and family. We want to show empathy and patience and reinforce social connections for them. So we can't mention these crisis lines enough. These prevention approaches include crisis lines, and we will be providing you with our direct number. As mentioned, there at South Texas Health System Behavioral, we have an intake department who specializes in helping individuals who may be at the very beginning of a situation that needs an intervention, or at the heights of a crisis. So the 988 number, the 911, 911 number, and then South Texas Behavioral Health's number. Now in schools, there has been some good progress in interventions in schools. There are programs that help students get access to care on site, and this makes it easier for them to be more compliant, and they don't have to leave school, so they're not getting behind on schoolwork. We need to remember that 1 in 6 kids contemplate suicide. Community gatekeepers, these are people like teachers, clergy, first responders. Everyone gets some portion of mental health education for these circumstances. Also, collaborative care models integrating mental health into primary care. It's not uncommon for us to go to our primary doctors and be asked about depression or anxiety, and very directly, have you ever had thoughts of suicide? It's important to have follow-up support. If someone goes to the emergency room or a psychiatric hospital, we do need to make sure that they are when they reintegrate into their world after such an intervention, that we're there for them and help ease that transition. And culturally adapted prevention programs for high-risk populations. We talk about veterans and different populations like that. Regarding public health and policy strategies, lethal means to access, we talked a little bit about how access to means increases risk. So restricting access to lethal means such as firearms through firearm storage or medication lockboxes, or when we have, like in our communities where there's bridges and those types of things, having barriers to where someone could hurt themselves. Expanding affordable and accessible mental health care is very vital. Integrating screening for depression and suicide in the health setting. Addressing substance abuse as a co-occurring risk factor, and investing in telehealth and rural outreach programs. This has really been a very critical way to get help to individuals who otherwise would not be getting the help. Implementing statewide suicide prevention action plans with measurable goals. We want to know what works, what doesn't, is it having an impact? As far as communities, we want to assure that our communities are promoting responsible media reporting on suicide, avoiding sensationalism when it comes down to that subject matter, highlighting stories of recovery and hope to reduce contagion effects, engaging in faith-based and community organizations in prevention efforts, and combating stigma through public awareness campaigns, and encouraging peer-to-peer support. Who better to know what someone is going through than someone who can relate? When we look at treatment strategies, medication, therapy are all very important. We have antidepressant medication. With medication, we can prescribe medication. Doctors can prescribe medication. The important piece to that is compliance. There have been some direct correlations with medications such as lithium, which is often used to treat bipolar disorder, where it reduces suicide risk up to 60%. Other medication, clozapine, reduces suicide attempts in individuals who have schizophrenia by 50%. Cognitive behavioral therapy reduces repeat suicide attempts almost by 50%. And dialectical behavior therapy reduces self-harm and suicide behaviors in 40 to 60%, and is especially effective for borderline personality disorder. Combined treatment, medication and therapy is often more effective than either one alone, and it reduces this risk. When we look at resources, I did list a few resources, a simple looking through the internet to try to see what type of resources are out there. Some that I was able to find is Reach Vet. It's a identify risk in veterans. The Wounded Warrior Project also relates to veterans. It's group therapy and coping programs. There's peer-based retreats, such as the Boulder Crest Warrior Path. Centerstone, this is in Tennessee. It's a universal suicide risk screening that has cut suicide deaths by 64% over 2 years in that area. In Laredo, monthly 988 rallies and awareness campaigns build grassroots prevention cultures. Telehealth counseling, as we mentioned, especially in rural areas. Ketamine therapies showed rapid reduction in suicide thoughts. Digital tools and crisis applications such as text-based counseling, AI-assisted triage, expand prevention opportunities, but it is important to be cautious with that. Peer-to-peer student support, and Sandy Hook Promise, which is Say Something. It's an anonymous reporting system credited with preventing youth suicides. So suicide is preventable. Connectedness, access to care, and hope does save lives. Help is only 3 numbers away or 9 numbers away. 3 numbers, 988 or 911. If we look at the intake department at South Texas Health System, our number is 956-388-1300, 956-388-1300. We end with this thought. Hope is being able to see that there is light despite all of the darkness. So please call us. We're there to help in the smallest to the largest critical situation that someone may be dealing with.
Community connectedness is so important, and understanding that we all play a role in helping prevent suicide, and the education you provided has been key. And so I would like to go over some of those stats and information that you gave. And so let's go through, first of all, like the risk of suicide. So obviously suicide does not discriminate. So main risk factors: history of suicide attempts, depression or other mental health disorders, substance use disorder. Substance use disorder, I think, is one that if you're dealing with a mental health condition, you may turn to substances, and then it becomes an issue that leads to suicide, right?
Right. Sometimes the source of that substance abuse may be because someone is depressed, so they're using these substances to cope, but all that does is give way to more problems. And when you're not in your senses, your inhibitions are lowered because of substance abuse. The symptoms of depression can be augmented. The lifelines that you have can be meaningless. So that is a big risk factor.
And we always talk about the correlation between physical health and mental health. And one of the risk factors is chronic pain or getting diagnosis of a life-threatening condition. You've been diagnosed with cancer or something like that. So protecting our physical health, is really important, but also if we're dealing with something like chronic pain, seeking help early to make sure that we avoid what could impact our mental health as well.
That's why your relationship with your primary care doctor is very important. There are agencies very specific to chronic pain. Whatever your individualized need is, who better to be able to identify that than your primary doctor or a family member or a friend.
And then you have the family history of someone who had a mental health disorder or who committed suicide. You also have the exposure to family violence. So that includes physical and sexual abuse. So I know that we hear about abuse a lot in the community. I know Domestic Violence Awareness Month, there's a whole awareness month for that. It's really important to be paying attention to the signs that somebody may be experiencing some sort of abuse.
Especially in children, the schools are the lifeline to kids who are going through that. They suffer in silence sometimes, and it's a very difficult situation for them. But not being able to reach out for help, internalizing the pain or maybe the guilt or maybe the self-blame, can really lead to some very serious problems.
Another one is a recent release from jail, and I know that we hear the stories of somebody being released from jail, having the difficulty of finding work, the having your family connections, things like that. There are some issues, so that's something to also be paying attention to.
And with that population, you're looking at the reintegration to society. And there's people don't really take very well to individuals who have had legal issues. So employment is difficult for them. Trust issues amongst friends and family leads to isolation. It can lead to chemical dependency, and at times they end up resorting to, breaking the law again because of that, because of the lack of support, the lack of understanding of what they're going through.
And then stressful life events. So a loss of a loved one, legal troubles, financial difficulties, interpersonal stressors, and that includes bullying, harassment, discrimination, and relationship trouble. So when we talk about stressful life events, we all deal with stressful life events.
Yes.
Each and every one of us have something that we're dealing with, whether it's a relationship issue that we're dealing with, or if we're experiencing harassment or discrimination or bullying. I mean, that is all ages and all, in male, female, it does not matter.
Right. I think the key to that is your ability to cope. So there are individuals who go through life having major stressors, but because of their upbringing, because of their education, because of their resilience, they're able to overcome that. And then there's those that don't have that opportunity. And so it's when people feel that point of hopelessness, because they have nowhere to turn to, is when it gets really really bad. But we all have the ups and downs. But when we need to be paying attention is when those ups and downs become excessive. The highs are maybe a little too high, or the lows become a little too low. And then we also look at longevity. Is it a transient situation, or does it last a long time?
Yeah, that lingering effect that it may have. You need to be paying attention to that, because life is cyclical, but if that cycle stays at the bottom too long,
right,
and when it comes to the Wheel of Fortune, if you feel like you're at the bottom the entire time, it can really weigh heavy on you.
Right, and that's why all of us becoming educated on those signs of anyone that's struggling are so important, because the people who you're with on a daily basis are the ones that are going to notice that. You may not notice it for yourself.
Mm-hmm. Now, is this statement true or false? Most people who have risk factors for suicide will not attempt suicide.
That's not true. Anybody, the smallest to the most riskiest situation, can lead to suicide. We can never take any mention of that lightly in any way, at any time.
And then it's difficult to tell who will act on suicidal thoughts. That's where you come into the issue of really determining if someone is thinking about it and who's going to actually act on it. And that's why you just have to have those conversations, because you never know who will act. It's one thing to think like, oh, I wish I weren't here anymore, but it's another thing to act on it.
Right, that is very true, yes.
Now let's talk about those early warning signs in younger children. So displaying aggression or being disobedient, throwing frequent temper tantrums, performing differently in school, receiving poor grades despite making strong efforts. What are some of those key indicators when it comes to kids that parents really need to be paying attention to besides those?
When you, like for example, we'll talk about bullying, right? When you have a child who refuses to go to school, and that's their struggle, and a parent is reading into that as them just misbehaving, it really is an opportunity to find out exactly why is there that change in behavior. There are a lot of things that kids go through in school that we, like I had mentioned, we may not understand or know unless we probe and we really observe and ask those questions.
Now, when we get to the teenage years, those early warning signs are eating or sleeping much more or less, frequently complaining about feeling sick or reporting aches and pains, rebelling against authority, missing school, stealing or vandalizing property, worrying excessively about gaining weight, feeling sad or negative for an extended period, coupled with lost appetite or thinking about death, often exploding in anger, abusing drugs and alcohol or smoking. Now, when we talk about these symptoms, I know you talk about those teen years, those angsty years. So you really have to be paying even closer attention, because some of that isn't just, the teen angst.
Right. It's very easy to chalk it up to, oh, they're just going through that time period in their life. Hormones are out of whack. They want to be independent, but yet they can't manage independence and those types of things. But it's you really have to hone in on exactly what's going on, and that's why those resources are so important. If you do see that in a child, I mentioned the schools are the first line of intervention. We rely a lot on teachers to identify those behaviors, so that they can talk to someone who can gauge what is this that's going on. Is this part normal? What we would call normal part of that age group and the milestones, or is there something more? And a simple conversation can really reveal that.
And I think that's why it's so important for parents to have that really good relationship with the teachers, because they see your kids 8 hours a day. You may wake them up in the morning, pick them up at the end of the day, have dinner with them, but they're seeing them during a big chunk of time.
Yes, and they're seeing them interact, and they're seeing how they abide by rules and their discipline and their connectivity to the social life in the school, and how they're doing academically. They have so many clues to the kids' behavior, because they are with them all the time, like you mentioned.
And then the early warning signs in adults, so eating or sleeping too much, pulling away from people and usual activities, having little or no energy, feeling numb as if nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family and friends. So these are all signs. Like, you start to see, like, obviously as we get older, we react a little bit differently to life. And so, but some of them are similar, but the feelings of feeling numb, I think, is one that sort of resonates, because there's a lot of people who sort of may be in a job that isn't giving them necessarily satisfaction, and they may start feeling that numbness to life.
Yes, and those things that you're talking about can be observable changes. And I think that we get so busy with life, with our immediate families, with just dealing with our own issues, so to speak, that at times, whenever you hear the story of someone who has completed suicide, we have to try to be careful not to be so busy that we lose touch with individuals who are dear to us. You will often hear someone say, oh, I hadn't talked to them in a long time. So just really taking a personal, not mental, inventory on your surroundings and the people that you love, and gauging how they're doing. A simple call can do that.
And I think it's become really difficult in today's age, because we live by text messages now. We don't call as we used to. Even our family, our friends, our loved ones, it's always a simple text, and it's always a, hope you're doing well, or how are you doing? But we're not really having those conversations that we used to have when we were talking on the phone or seeing each other more in person.
I think that's very true. But also, if you want to look at the other side of it, sometimes people will be more open through a text than they would in a conversation. So it can be either way. I think that, you hear a lot about, oh, we reconnected on Facebook, an old family member. I think that technology has helped reconnect individuals in a way that maybe we didn't expect. And yes, picking up the phone is much better. Being together is much better. But sometimes time constraints, our own lives get in the way. At minimum, you hear a text message, or you see a text message, read a text message from someone, and you at least know they're kind of okay. Just checking in, a quick chat, just to know that they're okay.
I think even just sending a text saying, thinking of you, hope you're well, I love you. Just one of those text messages, when you get it, it really makes you realize that you are not alone.
Right. A heart, goes a long way. It expresses so much. A smiley face, a sunshine in the morning.
A meme. People are sending memes all the time.
Right.
Just as long as people know that you're thinking about them, and they realize that you aren't alone.
Right.
Yeah. And then when it comes to treatment options, obviously, if someone is experiencing depression or anxiety, you would speak with a licensed professional counselor, get some help that way. When it comes to suicidal ideation, how is that treated? Is that something that you can come and talk to a therapist about and start those conversations? Or is it treated a little differently because it's talking about suicidal ideation?
It depends on the severity of what they're telling you. You may have to get police to go to their home immediately. If what they're saying is that they're actively in that thought process, that they have a way or a means of doing this, if they're alone, if they're saying things that no one loves them, no one's around them, based on that information, you may have to act right away. As opposed to someone who is a family member and says, I'm kind of concerned about my friend. I need them to maybe talk to somebody. Then you would deal with that differently.
Now, when it comes to calling the police, I think people are really afraid to call the police because just the visions of what they have as police coming, showing up at your door, breaking it down, whatever it may be. But police departments across the country have started creating mental health units, and I know FAR, Edinburgh, Mission certainly have them, and most of the departments have them. I know FAR was one of the first, and they really promoted it. What is the difference between a mental health unit versus the regular calling the police?
I think all law enforcement is trained to deal with mental health crisis. I think these mental health units get a higher level of training. And one of the things that I think is positive about these groups is that If a situation is more related to mental health, maybe domestic issues, the officers that maybe are not part of that team they have someone to lean on, and they can basically hand that off to the experts, so to speak.
Yes.
They're the subject matter experts, and I think it's a great resource internally within the department. And I think it's also a great thing because they're part of the community, and so they get to know their community very well. And I think there's even times when, you may have a call for service and it's a known patient, rather than have police go with sirens, lights, and like you mentioned with this show of force, the mental health unit, those that are in those units are going to be like, you know what, this is your call, and they know how to approach the situation, and they've had history. Most of the time they've had history with those individuals, and so they have rapport. They may even know a person on their police force in that unit that has a good way of communicating with that person. And I think that's a good thing for those individuals out in the community, that we've made progress in that regard. Police are not just intervening like law enforcement individuals who are enforcing things on people. There's a sensitivity to it, and their ability to identify what the next step is has really, I think, improved as well, and gets people where they need to be. We don't want law enforcement to be tied down with these patients. What we want is for them to be able to identify what the next step is, so that those people who are more able to help are in the right place.
And for those who may be struggling out there, we talk about the importance of building resilience. What are some ways that we can build resilience in ourselves?
It depends on what you're needing to be strong in and what you're needing to overcome. Professional help is always a good way to try to get that. We talked a little bit about the internet, and there are multiple ways that you can seek help. I think telemedicine, telepsychiatry has really helped people be a little less apprehensive to get help. I think people are really comfortable with technology. There's some that are and some that aren't, but I think that ability to sit in your own living room and talk to somebody about those deep feelings that you have, it's changing the landscape, and the ability for people to get better and to not get to this point of not wanting to live. A very common phrase is that suicide is a permanent solution to a temporary problem. And a lot of times, in my opinion, individuals who do commit suicide, it's an act that is impulsive, and maybe if something had just changed in that moment they were having that thought, then it wouldn't have happened. It's just the way things that line up.
And when we talk about what we can do to help somebody who may be struggling, the first key thing is to ask someone. So if you're concerned about them, to ask questions.
Yes.
Make sure.
Yes, definitely. Don't be afraid to have those direct conversations. I think you'd be better off erring or having a misconception of what somebody's going through by not asking, than asking and being wrong and then being offended, like, why are you asking me that? Oh, well, just making sure. You'd feel better about that, rather than hearing somewhere down the road that hesitation they had, that feeling I had about what they were telling me, it meant something more than and I missed it. You don't want that.
Yeah. Be there for them. This could be by phone or in person, but just being present is key.
Right.
And then keep them safe. So reducing access to lethal means for those at risk.
Yes, definitely so. We talked about some of the things that as a society, can take place with access to, for example, firearms. There's initiatives that can take place to help with that, even with children having access to these types of things. There's room to improve on that. And I had mentioned some examples where we probably need to go.
And then help them connect with ongoing support. So making sure that you direct them to help, but also I think the follow-up is really important, right? And making sure that you follow up. Did you speak with someone? Because you don't want to just leave it to chance.
Right, right. You need to find out how did it go. If you do lead someone in that direction of getting help, don't just leave it at that. Find out, how did it go? You never know. You may have led them in the wrong path, and you're not going to know unless you ask, and that may be a missed opportunity. So you want to follow up and you know, have them give you feedback. Maybe the provider you refer them to is not the right connection. So we don't want people to give up on seeking help just because of an experience that they had that didn't work out for them.
Yeah. And then when it comes to suicide prevention, there are the 3 R's. So if you're taking notes, it's really easy to remember the 3 R's. So the first one is recognize. So recognizing the warning signs and symptoms. If we've talked about that, that recognition is key, right?
Right.
And following your gut. I think just listening to your gut will tell you, especially as a mom, as a parent, you probably know this, right?
Right, yes, definitely. Anytime you have an ill feeling, you have to go with that feeling. I think that when we don't, we can regret that. We're human, and we by nature we want to protect people. We have a survival instinct, and it's innate in us. It's a gift that we've been given, and like I mentioned, if it's wrong, it's wrong. But if it's right, it's life.
Yeah. So once you recognize, the next R is to respond. So taking that action, and that's the thing is, it's one thing to feel something, but you don't want to have the regret, as you've talked about numerous times. You don't want to have regret later, should someone complete a suicide, that you could have done something. So responding.
Responding is absolutely right. I guess when you pose that question, I think there's a flip side to it. Yes, you want to respond. You want to ignore the sign, but individuals who are contemplating suicide, or if they are successful, and you can really beat yourself up about missing something. And I think it's important to know that we all have free will, and everyone makes the decisions that they make on their own. We're ultimately responsible for ourselves. So being careful also on the flip side not to have excessive guilt or feelings, because then that can also lead to another situation.
Yes.
You know, of difficulty coping with that loss. So if you do everything that you can, that you feel that you've done everything that you can, and you're educated and you have the resources, and you're not ashamed or you're not shy about sharing that information or asking those questions, that's the key. And the last R is refer. So referring them to those resources that are available out in the community. And STHS Behavioral does offer confidential assessments. So tell us, how does that work? If somebody is to call the 388-1300 line at STHS Behavioral, what would an assessment entail? So we want to know basic information. We want to know, of course, the demographic information is important, especially if it's a crisis. Because we need to get help out there. But we're going to ask questions. What is it that you're seeking help for? And based on that information, that answer is going to tailor what the next steps are going to be. If you call and let's say you call and you really don't know what to do next, we're going to guide you in that direction. A lot of times it's important to see someone face to face, so we encourage someone walking in to talk to us. Sometimes you get calls from somebody who is a parent for a child, and so you really want to bring that child in so that you can talk to them and see what they're saying. Are those observations that the parent is making accurate? And so we encourage that face-to-face. At times people are very, they don't want to give you information. They just want to know, where do I go? I just need a psychiatrist. I don't want anything else. So we provide that. We have excellent resources, in person, telepsychiatry, that we can steer them to as well. And for your last message that you would want to tell anybody who is watching right now, what would you want to tell somebody who is struggling with suicidal ideation? What would be your words to tell them right now? I think that you would be amiss if you didn't understand that there is hope, and that there are individuals who make efforts, who make it part of their life to help, and not recognizing that, which it's natural when you're not feeling well to feel that way. But my message is that I'm here for you. We're here for our community as a hospital. No matter how small or how big a situation is, you really are not alone, because there's individuals who have dedicated their life to helping for their own reasons. Maybe they've been through this. Maybe they've had family members who've been through this. None of us are immune to this, and all it is that it's just that little extra step towards a positive direction for that minute instead of going the opposite direction. Don't ever take things into your own hands when you feel that you have no way out. There is always some type of help. It may not be the way you define it, but there is going to be something that's going to open a way for you.
Yeah, remember that hopeless and helpless have the words hope and help in there, and there is plenty of hope and help in this community.
Yes, there is.
All right, thank you so much for your time, Linda. We
You're
really
welcome.
appreciate it. And that officially concludes our webinar. We thank you for joining us. We hope you will continue to prioritize your mental health and the mental health of your loved ones. If you are experiencing mental health challenges, STHS Behavioral can help. The facility has served the South Texas community for more than 30 years, offering inpatient and outpatient treatment options. If you or a loved one is experiencing a mental health issue, you can schedule a confidential assessment by calling our hotline at 388-1300. Please remember, you are not alone. Speak with a loved one or seek professional help if you need emotional or mental health support. And if you are experiencing a mental health crisis, please call the National Suicide and Crisis Line at 988. Licensed counselors are available to speak with you in English and Spanish 24 hours a day, 7 days a week. Now, don't miss our next installment of this Let's Talk Mental Health series on Thursday, October 2nd, broadcast live at 5:30 p.m. via Facebook as we discuss trauma and its impact on mental health. We hope you can join us. And to watch our previous Let's Talk Mental Health webinars, all you have to do is visit sthsletstalk.com. Until our next webinar, stay healthy, stay safe, and please prioritize your mental well-being. Sometimes life's burdens can take their toll on your emotional well-being. If you or a loved one is struggling, know that you are not alone. South Texas Health System Behavioral can help you cope with depression, manage feelings of anxiety, regain control of mood swings, and recover from substance use disorders. Our staff is available 24/7, offering the quality and compassionate inpatient and outpatient care you need to overcome life's challenges. South Texas Health System Behavioral, where your mental health is our priority.